Pregnancy of the female dog. Everything you need to know. Are you planning to have your dog mate a litter? Before making such a decision, it is important to be well informed about the procedure to follow. Covering and gestation, diagnosis, follow-up must be managed carefully and especially with the help of your veterinarian so that everything goes well. You will find in our file the answers to your questions as well as advice on the nutrition of the female dog and the preparation for whelping. When should I mate my female dog? Breeding is the term that describes the mating of the female dog with the male. The latter often being chosen by the owner according to criteria of breed and size. To determine the mating period, you must first know when the female dog is ovulating. This usually occurs 10 days after the onset of heat. To maximize the chances of fertilization, it is recommended to mate the female several times between the 10th and 21st day of the cycle, at the time of losses. As far as age is concerned, we can consider breeding the female dog from 1 year old for small breeds, and from 2 years old for large breeds. In addition, the risk of complications increasing with age, it is not advisable to mate the female dog beyond her 8 years, 6 years for large breeds. Seeking advice from your veterinarian remains the most reliable solution to avoid risks. How do I know if my dog is expecting babies? Pregnancy can be diagnosed in different ways. Observation of the behavior of the female dog, palpation, ultrasound, weight gain, swelling of the udders. The female dog may become more clingy, seeking affection, even nervous or hypersensitive. As in women, pregnancy can result in nausea and vomiting in the first days of pregnancy. After some time, we may observe a weight gain going hand in hand with an increased appetite, then a loss of appetite as farrowing approaches. The udders then grow and it is possible that milk will flow out. From the 45th day of gestation, the female dog is likely to spend a lot of time sleeping and her belly will begin to round out noticeably. Finally, palpation and ultrasound are performed by the veterinarian, who will be able to make a definitive diagnosis. How long does gestation last? The average length of gestation is 60 to 70 days, or about 2 months. This duration varies from one race to another and can be shortened to around 50 days depending on the case. The days are counted from the mating of the female dog, but it is not always easy to know if the mating has worked well and if the female dog has really been impregnated. It is possible to detect pregnancy by abdominal palpation from the 35th day, and by ultrasound from the 20th day. Only the veterinarian is able to precisely determine the duration of gestation through ultrasound, by observing the size of the embryos and their stage of development. A second ultrasound will be performed around the 25th day to ensure that the pregnancy is progressing smoothly. Does pregnancy involve risks? Yes, there are potential risks of miscarriage and infection. To deal with all these eventualities, it is essential to provide good care to the female dog during her pregnancy. First, she must be properly dewormed and vaccinated. A first dewormer should be administered at the start of heat, and a second about 3 weeks before birth. Vaccinations must be up to date and, if possible, renewed before mating so that the mother can transmit her antibodies to the puppies. Be careful. No vaccination should be done during pregnancy and you should avoid giving medication to the female dog during this period. Some could cause a miscarriage. During pregnancy, certain infections can also occur, caused in particular by the presence of bacteria, salmonella, streptococci, or parasites, fleas, intestinal worms. For this reason, hygiene in the house must be irreproachable and especially concerning the female dog's belongings: cushions, basket, bowls, toys. Unfortunately, the pregnant female dog is also exposed to pregnancy accidents, against which there is no treatment. That is, the little ones will most often come to die. However, if the problem is detected early enough, the life of the dog will not be in danger provided that the necessary action is taken as soon as possible. In these cases, which remain rather rare, surgery must be performed and it is even possible to save the puppies with a caesarean section. Possible mishaps include ectopic gestation, kids develop in the abdomen, uterine torsion, which needs to be operated on quickly, herniation, strangulation of the uterus, and supergestation, 2 litters at a time. Feeding the pregnant dog. On this point, it is really necessary to pay attention to the nutritional needs of the female dog and to make a change of diet during gestation but also during the breastfeeding period. Indeed, the food needs of the mother to become greater, requiring richer energy intakes that should be divided. From the 5th week of gestation, it is recommended to increase the normal meal by 10% per week, and the food must be more protein, 30% protein minimum. The mineral needs are also increased, and it is necessary to compensate for any deficiencies so that the health of the puppies does not suffer. There are food supplements intended for this purpose in the shops or in veterinary practices. If your female dog used